Today I would like to share with you my personal journey and approach to healing Crohn's disease. It's important to note that I am not a medical professional, but I have discovered a combination of dietary practices that have worked for me, and I want to share my experience. Crohn's disease is a chronic inflammatory bowel disease that can cause significant discomfort and disruption in one's life. Over the years, I have experimented with various approaches to manage my symptoms, and I have found that a cycle of a carnivore diet, fasting, and a transition back to a diet rich in fruits, vegetables, and lean meats has been beneficial for me. Let's break down this approach into its different components. The carnivore diet involves consuming primarily animal-based foods, such as meat, fish, eggs, and certain dairy products, while excluding most carbohydrates, including fruits and vegetables. Some proponents of this diet believe that it can help reduce inflammation and provide relief for certain autoimmune conditions, including Crohn's disease. Following a period of carnivore diet, I incorporate fasting into my routine. Fasting involves abstaining from food for a designated period of time, which can vary depending on individual preferences and health considerations. Fasting has been practiced for centuries and is believed to have various health benefits, including reducing inflammation, improving gut health, and promoting cellular repair and regeneration. After completing a fasting cycle, I gradually reintroduce fruits, vegetables, and steaks back into my diet. This transition allows me to reintroduce essential nutrients, fiber, and a wider variety of foods to support overall health and well-being. However, it's important to note that each person's dietary needs and tolerances may vary, and it's crucial to listen to your body and consult with a healthcare professional before making any significant changes to your diet. In addition to these dietary adjustments, I also reduce my intake of sugar as much as possible. Sugar, particularly refined sugars, has been linked to increased inflammation and can exacerbate symptoms of Crohn's disease. By eliminating or significantly reducing my sugar intake, I aim to create an environment in my body that is less prone to inflammation and flare-ups. While my personal experience has shown positive results, it's important to emphasize that everyone's journey with Crohn's disease is unique. What works for one person may not work for another. It is crucial to consult with healthcare professionals, such as gastroenterologists and registered dietitians, who can provide personalized guidance and ensure that any dietary changes are safe and appropriate for your specific condition. In conclusion, my personal approach to healing Crohn's disease involves cycles of a carnivore diet, fasting, and a transition back to a diet rich in fruits, vegetables, and lean meats, while minimizing sugar intake. This approach has provided me with relief and improved my overall well-being. However, it's essential to remember that individual experiences may vary, and it's crucial to work closely with healthcare professionals to develop a personalized treatment plan for managing Crohn's disease and feel great. Now, some questions you might have about Crohn's disease. What is Crohn's disease? Crohn's disease is a chronic inflammatory bowel disease that primarily affects the digestive tract. What are the common symptoms of Crohn's disease? Common symptoms include abdominal pain, diarrhea, rectal bleeding, weight loss, fatigue, and malnutrition. Is there a cure for Crohn's disease? Currently, there is no known cure for Crohn's disease, but various treatments can help manage symptoms. What causes Crohn's disease? The exact cause is unknown, but factors like genetics, immune system dysfunction, and environmental triggers may contribute. How can diet impact Crohn's disease? Diet plays a significant role in managing symptoms and promoting overall health for individuals with Crohn's disease. What is a Crohn's disease flare-up? A flare-up refers to a period of increased disease activity, characterized by worsened symptoms. Can diet alone treat Crohn's disease? While diet alone cannot cure Crohn's disease, it can help alleviate symptoms and improve quality of life. What is a low-residue diet? A low-residue diet reduces fiber intake to minimize bowel movements, offering relief during flare-ups. What foods should be avoided with Crohn's disease? Foods that commonly trigger symptoms include spicy foods, high-fiber foods, caffeine, alcohol, and fatty foods. What foods are generally well tolerated for individuals with Crohn's disease? Individuals with Crohn's disease often find relief with low-fiber foods like cooked vegetables, lean proteins, and soft fruits. Is there a specific Crohn's disease diet plan? While there's no one-size-fits-all diet plan, some approaches like the specific carbohydrate diet, SCD, or the low FODMAP diet may be helpful for certain individuals. Should I avoid dairy products? Dairy products can worsen symptoms for some individuals, but others may tolerate them well. It's important to identify personal triggers. Are there any supplements that can help with Crohn's disease? Certain supplements like omega-3 fatty acids, probiotics, and vitamin D may provide additional benefits. Consult a healthcare professional before taking any supplements. Can stress aggravate Crohn's disease symptoms? Yes, stress can trigger or worsen symptoms. Stress management techniques like meditation or therapy may help alleviate symptoms. Is smoking harmful for Crohn's disease? Yes, smoking can worsen symptoms and increase the risk of complications. Quitting smoking is highly recommended. What is the role of medication in treating Crohn's disease? Medications such as anti-inflammatories, immunosuppressants, and biologics are commonly prescribed to reduce inflammation and manage symptoms. Can surgery cure Crohn's disease? Surgery may be necessary to remove affected portions of the digestive tract or manage complications, but it does not cure the disease. What are the potential complications of Crohn's disease? Complications may include strictures, fistulas, abscesses, malnutrition, osteoporosis, and an increased risk of colon cancer. How can I manage diarrhea associated with Crohn's disease? Managing diarrhea often involves dietary adjustments, hydration, medications, and monitoring for potential infections. Is it safe to consume alcohol with Crohn's disease? Alcohol can irritate the digestive tract and worsen symptoms. It's generally recommended to limit or avoid alcohol consumption. How does Crohn's disease affect nutrient absorption? Crohn's disease can impair the absorption of various nutrients, leading to deficiencies. Regular monitoring and supplementation may be necessary. Can exercise help with Crohn's disease? Regular exercise can improve overall health, boost mood, and alleviate stress, which may have a positive impact on Crohn's disease management. What are some natural remedies for Crohn's disease? While natural remedies cannot replace medical treatment, some individuals find relief with herbal supplements like aloe vera or turmeric. Consult with a healthcare professional before trying any natural remedies. How can I manage abdominal pain associated with Crohn's disease? Pain management options include over-the-counter pain relievers, prescription medications, hot packs, and relaxation techniques. Are there any specific diets or remedies to induce remission in Crohn's disease? Specific diets or remedies to induce remission are not widely recognized. Can I participate in physical activities with Crohn's disease? Physical activities are generally encouraged, but it's important to listen to your body and avoid strenuous exercises during flare-ups. What role does hydration play in managing Crohn's disease? Staying hydrated is crucial to prevent dehydration and maintain bowel regularity. Drink an adequate amount of fluids throughout the day. Is it necessary to keep a food diary? Keeping a food diary can help identify trigger foods and patterns of symptoms, aiding in the management of Crohn's disease. How can I manage nausea and vomiting associated with Crohn's disease? Small, frequent meals, ginger-based products, and anti-nausea medications may help manage nausea and vomiting. Can Crohn's disease affect fertility and pregnancy? Crohn's disease does not directly affect fertility, but it's important to discuss family planning and pregnancy with a healthcare professional due to potential complications. What is the role of fiber in Crohn's disease management? Fiber can be challenging to digest for individuals with Crohn's disease. It's advisable to limit fiber during flare-ups and gradually increase intake during remission. Is Crohn's disease hereditary? There is a genetic component to Crohn's disease, but it doesn't guarantee that relatives will develop the condition. How can I prevent malnutrition with Crohn's disease? Working with a dietitian to develop a balanced diet plan and addressing nutrient deficiencies through supplementation can help prevent malnutrition. Can Crohn's disease affect mental health? Crohn's disease can impact mental health due to the chronic nature of the condition. Seeking support from mental health professionals is recommended. Can stress reduction techniques aid in Crohn's disease management? Stress reduction techniques like meditation, yoga, deep breathing exercises, and counseling can help manage symptoms and improve overall well-being. What is the role of surgery in treating Crohn's disease? Surgery is typically considered when medication and other therapies fail to control symptoms or when complications arise. How can I manage fatigue associated with Crohn's disease? Fatigue can be managed by getting adequate rest, practicing good sleep hygiene, and engaging in gentle exercises. Are there any specific diets that promote healing in Crohn's disease? While no specific diet can heal Crohn's disease, a nutrient-rich diet focused on whole foods can promote healing and overall well-being. How can I deal with anxiety related to Crohn's disease? Cognitive behavioral therapy, relaxation techniques, and support groups can be helpful in managing anxiety associated with Crohn's disease. Can Crohn's disease affect children? Yes, Crohn's disease can affect individuals of any age, including children. Pediatric gastroenterologists specialize in managing Crohn's disease in children. Are there any alternative therapies for Crohn's disease? Alternative therapies like acupuncture or chiropractic care may provide symptom relief, but their efficacy varies, and it's important to consult with a healthcare professional. How can I prevent dehydration during a flare-up? Drink plenty of fluids, including water, herbal tea, and clear soups. Oral rehydration solutions may be recommended for severe dehydration. Can Crohn's disease increase the risk of colon cancer? Having Crohn's disease increases the risk of developing colon cancer. Regular colonoscopies are crucial for early detection and treatment. How does Crohn's disease affect the immune system? Crohn's disease involves an abnormal immune response, causing inflammation in the digestive tract. Can I eat fruits and vegetables with Crohn's disease? Soft fruits and cooked vegetables are generally well tolerated, but individuals should monitor how their bodies respond and adjust accordingly. Are there any clinical trials or experimental treatments for Crohn's disease? There are ongoing clinical trials investigating new treatments and approaches for Crohn's disease. Discuss with a healthcare professional about potential options. Can Crohn's disease affect the skin? Crohn's disease can cause skin manifestations like rashes, ulcers, or fistulas around the anus. How can I manage weight loss associated with Crohn's disease? Working with a dietitian to optimize calorie and nutrient intake, consuming smaller meals more frequently, and incorporating healthy fats can help manage weight loss. Is Crohn's disease a type of autoimmune disease? Yes, Crohn's disease is considered an autoimmune disease as the immune system mistakenly attacks healthy cells in the digestive tract. How can I manage constipation associated with Crohn's disease? Increasing fiber intake gradually, staying hydrated, and discussing laxatives or stool softeners with a healthcare professional can aid in managing constipation. Are there any specific cooking techniques recommended for individuals with Crohn's disease? Cooking methods like steaming, baking, or boiling are generally better tolerated than frying or grilling, which can be harder to digest. Can Crohn's disease affect bone health? Crohn's disease can lead to decreased bone density and an increased risk of osteoporosis. Adequate calcium and vitamin D intake, along with weight-bearing exercises, are essential. How can I support a loved one with Crohn's disease? Educate yourself about the condition, offer emotional support, and be understanding of their limitations and needs. Can Crohn's disease affect the eyes? Crohn's disease can cause inflammation in the eyes, leading to symptoms like redness, pain, or blurred vision. An ophthalmologist can provide appropriate treatment. Is it safe to fast or do a cleanse with Crohn's disease? Fasting or doing a cleanse can potentially worsen symptoms and lead to nutritional deficiencies. Consult with a healthcare professional before attempting any drastic dietary changes. What are the potential side effects of Crohn's disease medications? Medications for Crohn's disease can have side effects ranging from mild to severe. It's important to discuss potential risks and benefits with a healthcare professional. Can Crohn's disease affect liver function? Crohn's disease can cause inflammation in the liver, leading to conditions like primary sclerosing cholangitis, PSC. Regular liver function tests are recommended. How can I manage gas and bloating associated with Crohn's disease? Managing gas and bloating may involve avoiding gas-producing foods, eating smaller meals, and discussing over-the-counter medications with a healthcare professional. Can I travel with Crohn's disease? Traveling with Crohn's disease requires planning and preparation, including carrying necessary medications, documents, and knowing the location of medical facilities. Are there any support groups for individuals with Crohn's disease? Support groups provide a valuable platform for sharing experiences, obtaining information, and receiving emotional support. Look for local or online support groups. How can I reduce inflammation in Crohn's disease? Medications prescribed by a healthcare professional are the primary way to reduce inflammation in Crohn's disease. Some individuals may also find relief with anti-inflammatory diets. Can Crohn's disease affect the mouth and oral health? Crohn's disease can cause mouth ulcers, swelling of the lips, and other oral manifestations. Regular dental care is important. How can I manage anemia associated with Crohn's disease? Treating anemia may involve iron supplementation, dietary adjustments, and addressing underlying inflammation and malabsorption issues. Can Crohn's disease affect the joints? Crohn's disease can cause joint pain and inflammation, a condition known as enteropathic arthritis. Consult with a rheumatologist for proper management. Is it safe to take non-steroidal anti-inflammatory drugs, NSAIDs, with Crohn's disease? NSAIDs can worsen symptoms and increase the risk of complications in individuals with Crohn's disease. Consult with a healthcare professional for alternative pain relief options. How can I manage medication side effects in Crohn's disease? If you experience side effects from medications, discuss them with your healthcare professional. Adjustments or alternative medications may be necessary. Can Crohn's disease affect the kidneys? While rare, Crohn's disease can lead to kidney complications, such as kidney stones or inflammation. Regular monitoring is important. How can I support a child with Crohn's disease? Ensure the child follows their treatment plan, advocate for their needs at school, and provide emotional support. Pediatric gastroenterologists can provide guidance. Can Crohn's disease affect the reproductive system? Crohn's disease itself doesn't directly affect the reproductive system, but complications and medications can have implications for fertility and pregnancy. How can I manage heartburn and acid reflux with Crohn's disease? Eating smaller, frequent meals, avoiding trigger foods, elevating the head while sleeping, and discussing antacids with a healthcare professional can help manage heartburn and acid reflux. Can Crohn's disease affect mental cognition? Crohn's disease can cause brain fog or cognitive difficulties in some individuals. Rest, stress reduction, and mental stimulation can help manage these symptoms. How can I maintain a healthy weight with Crohn's disease? Working with a dietitian to develop a personalized meal plan, incorporating nutrient-dense foods, and managing portion sizes can aid in maintaining a healthy weight. Can Crohn's disease cause mouth sores? Yes, mouth sores or aphthous ulcers can occur in individuals. How can I manage strictures in Crohn's disease? Strictures, narrowed sections of the digestive tract, may require dietary modifications, medications, or surgical intervention. Consult with a gastroenterologist for proper management. Can Crohn's disease affect the nervous system? While rare, Crohn's disease can involve the nervous system, leading to conditions like peripheral neuropathy. Neurologists can provide appropriate treatment. How can I manage symptoms during a Crohn's disease flare-up? During a flare-up, rest, stick to a bland diet, stay hydrated, and take medications as prescribed. Contact your healthcare professional if symptoms worsen. Can I drink coffee with Crohn's disease? Coffee can be irritating to the digestive tract for some individuals with Crohn's disease. Monitor how your body responds and limit or avoid it if necessary. How can I manage fistulas in Crohn's disease? Fistulas, abnormal connections between organs, may require medication, antibiotics, surgical intervention, or specialized wound care. Consult with a gastroenterologist or surgeon for proper management. Can stress-reducing activities like yoga or meditation help with Crohn's disease? Engaging in stress-reducing activities can help manage symptoms and improve overall well-being for some individuals with Crohn's disease. How can I manage food cravings with Crohn's disease? Identify triggers for food cravings, find healthier alternatives, and practice portion control to manage food cravings effectively. Can Crohn's disease affect sleep patterns? Crohn's disease-related symptoms and discomfort can disrupt sleep patterns. Creating a comfortable sleep environment and establishing a bedtime routine can promote better sleep. Can Crohn's disease affect the bladder? Crohn's disease can cause inflammation in the bladder, leading to symptoms like frequent urination or urinary tract infections. Consult with a urologist for proper management. How can I manage nausea during a Crohn's disease flare-up? Small, frequent meals, ginger-based products, and anti-nausea medications may help manage nausea during a flare-up. Can Crohn's disease affect the thyroid? While uncommon, Crohn's disease can impact the thyroid gland, leading to conditions like hypothyroidism or thyroid nodules. Endocrinologists can provide appropriate care. How can I manage hemorrhoids associated with Crohn's disease? Maintaining good hygiene, using over-the-counter hemorrhoid creams, and discussing treatment options with a healthcare professional can aid in managing hemorrhoids. Can Crohn's disease affect the lungs? Crohn's disease can cause inflammation in the lungs, leading to conditions like bronchitis or pneumonia. Consult with a pulmonologist for proper management. How can I manage mouth inflammation, stomatitis, in Crohn's disease? Rinsing with salt water, using topical corticosteroids, or discussing prescription mouthwashes with a healthcare professional can help manage mouth inflammation. Can Crohn's disease affect the pancreas? While rare, Crohn's disease can involve the pancreas, leading to conditions like pancreatitis. Gastroenterologists can provide appropriate care. How can I manage anxiety about eating with Crohn's disease? Working with a dietitian to develop a safe and personalized meal plan, practicing mindful eating, and seeking support from mental health professionals can help manage anxiety about eating. Can Crohn's disease affect the ears, nose, or throat? While uncommon, Crohn's disease can cause inflammation in the ears, nose, or throat, leading to conditions like sinusitis or ear infections. Consult with an otolaryngologist for proper management. How can I manage skin complications like abscesses or fistulas in Crohn's disease? Managing skin complications often involves medications to reduce inflammation, wound care, and surgical intervention. Consult with a gastroenterologist or surgeon for proper management. Can Crohn's disease affect the gallbladder? Crohn's disease can cause inflammation in the gallbladder, leading to conditions like gallstones or cholecystitis. Gastroenterologists or surgeons can provide appropriate care. How can I manage dry mouth associated with Crohn's disease? Staying hydrated, using sugar-free candies or gum, and discussing saliva substitutes with a healthcare professional can help manage dry mouth. Can Crohn's disease affect the esophagus? Crohn's disease can cause inflammation in the esophagus, leading to symptoms like heartburn or difficulty swallowing. Gastroenterologists can provide appropriate care. How can I manage inflammation in the perineal area? Managing inflammation in the perineal area may involve topical creams, sitz baths, and antibiotics. Consult with a gastroenterologist or surgeon for proper management. Can Crohn's disease affect the adrenal glands? While rare, Crohn's disease can involve the adrenal glands, leading to conditions like adrenal insufficiency. Consult with an endocrinologist for proper management. How can I manage fistulizing Crohn's disease? Fistulizing Crohn's disease may require a combination of medications, antibiotics, surgical intervention, or specialized wound care. Consult with a gastroenterologist or surgeon for proper management. Can Crohn's disease affect the spleen? Crohn's disease can cause inflammation in the spleen, leading to conditions like splenomegaly. Gastroenterologists can provide appropriate care. How can I manage symptoms during travel with Crohn's disease? Plan ahead, carry necessary medications and supplies, be mindful of food choices, and locate medical facilities in your travel destination. Can Crohn's disease be cured? Crohn's disease is a chronic condition with no known cure. However, with proper management, including medications, lifestyle adjustments, and regular monitoring, symptoms can be controlled, and individuals can lead a